Hi friends, it's Dr. Arianne here from the Movement Paradigm. Today I'm going to talk a little bit about candida or yeast overgrowth. So recently I have seen quite a few patients that have presented with signs and symptoms of some type of yeast overgrowth. And I think therefore it is a very important topic to address because it's frequently overlooked in conventional medicine, sometimes overdiagnosed in functional medicine. So some of the things that they were experiencing: digestive issues such as constipation to diarrhea, general malaise, and just overall fatigue. They also were experiencing some skin issues, anything from acne to psoriasis, eczema, itchy skin, vaginal yeast infections, and everything in between. Another thing is that they were having emotional issues and then the inability to lose weight. So these were some of the frequent contributors, but there are many other signs and symptoms of this. So, what is the first thing that we look at to diagnose this potential condition? One is that you can do stool analysis, you can do urine culture, and you can also do blood work, in addition to a very basic questionnaire that will tell you the probability of a candida overgrowth. So that will look at, are you a mild, moderate, or severe probability of having this overgrowth. In addition to just a physical exam, and listening to a patient's signs and symptoms can really help to paint the picture of, is this a likely possibility of what's driving their condition for them to not feel well. One of the questions I always ask on my questionnaire and then in person is, when's the last time you felt well? Sometimes people don't even know. It could be years, months, for really so a long time. So it's really important to just say, when did you actually feel good? Okay, so after a diagnosis, there of course are definitely ways to treat this yeast overgrowth, especially if this is a primary driver. And this can be a driver for thyroid issues, as well as many other inflammatory disorders. We know that the gut is linked to almost every type of condition you can imagine because it's 70% of our immune system. So it is linked to neurodegenerative diseases, it's linked to autoimmune diseases, it's linked to chronic disease, heart disease, diabetes, and so on. So we know that it's a really huge driver. So if there is a yeast overgrowth or imbalance, over time, that is going to increase your susceptibility of another condition, okay? And it's something that's very treatable. So when you are treating it, just as we always do in functional medicine, we're looking to remove the triggers. So what are the inflammatory triggers? What are the things that contribute to this? One is going to be alcohol. One is going to be antibiotic use. So one round of antibiotics can change your microbiome forever. So multiple rounds of antibiotics. Some of my young females have had 20 plus in their 20 years of life. So oral contraceptives are another huge contributor to it. Stress, alcohol use. So all of these things, even some antacids that are frequently prescribed for heartburn and reflux, those are all things that can contribute to yeast overgrowth. So those are going to be some of the things that we want to remove, preferably in the beginning. Definitely a diet free of sugar, flour, alcohol. That's going to be one of the primary things to really just let the gut settle and try to rebalance it. Some people who have experienced more severe symptoms may need an antifungal. That would be prescribed by your physician, and it would be closely monitored because there are a lot of interactions with other medications, and it needs to be monitored to make sure that this is an appropriate drug for this person. If that is not used, there are other types of herbs that are used in the treatment of yeast overgrowth. So one is caprylic acid, one is going to be oregano. So these things have been shown to be very beneficial, and as well as other botanicals. The next is going to be digestive enzymes. So it's really helping to break down the food, help to assimilate so we can absorb more nutrients. That is also part of just replacing what the body needs. We want to reinoculate Really important with this, so that's going to be re-inoculating with probiotics, and so you're adding good bacteria into the gut. And of course, as always, we may need to rebalance our lifestyle. So decreasing stress, making sure that we're not, surrounded by carbohydrate and sugar type foods all the time. So cleaning out the cabinets. And, there's many other, steps that you can take, but ultimately, you have to create a lifestyle that can really be sustainable, right? And if you are a likely candidate for yeast overgrowth, sometimes people need to be very, very, diligent about just a low sugar diet forever. Some people can be a little bit more flexible. It just depends on the severity of your symptoms. It depends on who you are. So there's, of course, it's always unique to each individual. With that said, it is possible to do it, and it is also a very common thing that is seen, just especially because of modern society. So make sure that you take time to get diagnosed, seek out a functional medicine practitioner. I'm more than happy to send you a questionnaire. You can email me at drarianne@themovementparadigm.com, and I can send it to you, and you can just see if that's a possibility for you. All right, thank you so much. If you have any questions, please reach out as always. Bye.